Cheese has had a special place on the American plate, from gooey pizza slices to gourmet charcuterie boards. But as health awareness grows, many people wonder, how does cheese affect specific health conditions? The answer isn't black and white. Cheese can be both beneficial and problematic, depending on your health status and how much you consume. For people with heart disease or high cholesterol, cheese often gets a bad reputation. Traditional cheeses are high in saturated fat and sodium, both linked to elevated cholesterol and increased blood pressure. Excess intake could make conditions like hypertension or cardiovascular disease harder to manage. Yet, research shows that moderate portions of certain cheeses, like mozzarella, feta, or cottage cheese, may be safer options because they contain less fat and sodium. The key is mindful consumption and choosing varieties that align with heart-healthy guidelines. Cheese also plays a complex role in diabetes management. Full-fat cheese does not directly spike blood sugar since it's low in carbohydrates. In fact, some studies suggest that fermented cheeses like cheddar or Swiss may improve insulin sensitivity, thanks to probiotics and bioactive compounds. However, portion control is vital, as excess calories from cheese can contribute to weight gain. One of the biggest risk factors for worsening type 2 diabetes. Pairing cheese with fiber-rich foods, like vegetables or whole grains, can help balance its effects. For individuals with osteoporosis or risk of bone loss, cheese can be a valuable ally. Rich in calcium, protein, and vitamin D in fortified varieties, cheese supports bone density and strength. Parmesan, for instance, delivers a concentrated dose of calcium in small servings. That said, lactose-intolerant individuals often worry about dairy. Interestingly, many hard cheeses like cheddar, Swiss, and Parmesan are naturally low in lactose, making them easier to digest. This means even those with lactose sensitivity may still enjoy cheese without major discomfort. When it comes to gut health, aged and fermented cheeses stand out. Options like blue cheese, Gouda, and cheddar contain probiotics that support digestive balance. These good bacteria may help reduce bloating, improve immune function, and even support mental health through the gut-brain connection. Still, highly processed cheese products, think cheese spreads or American singles, lack these benefits and often come loaded with additives. Americans also frequently ask about cheese and weight management. Surprisingly, cheese doesn't have to be off-limits. Studies show that including moderate amounts of cheese in a balanced diet may actually support satiety, helping people feel fuller for longer. Cottage cheese and ricotta, high in protein but relatively lower in fat, are great choices for those watching their waistlines. The takeaway: cheese is not a one-size-fits-all food. For people with heart disease, diabetes, osteoporosis, or digestive issues, the type of cheese, the portion size, and the frequency of consumption matter more than the occasional indulgence. In the U.S., where cheese is both a comfort food and a culinary staple, learning to pair it wisely with vegetables, whole grains, and lean proteins can transform it from a dietary risk into a health-supporting ally.